public comment or otherwise participate in the meeting may do so. Additionally, the meeting will be broadcast live in real time via Westborough on local cable, Verizon Channel 28, and Charter 192, and their online platforms, westboroughTV.org and youtube.com/WestboroughTV. Every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. If we are unable to do so, despite best efforts, we'll post on the Town of Westborough website an audio or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. Now that that's out of the way, I think our first agenda item was the Hunan Kitchen, and I believe that we have somebody on the call from Hunan Kitchen. Is that correct? I'm not hearing an affirmative. Can someone just confirm that we do have Hunan Kitchen here?
Hello. Hello.
Yes. Hello. Now we can hear you.
And Warning Chen or Frank, you can call me Frank, and the owner of Hunan Kitchen.
Excellent. Thank you. So I was hoping we could have somebody kind of introduce this issue to us first. I don't know if Maria or Ray, if one of you two are the best people to kind of introduce this. Is that Maria?
Sure. So just to backtrack a little bit, so on October 14th was the first time that Jen and I had visited, and that was the time that they were operating with a food permit. They had been prepping food in the dining area, and we at that time had explained to them, and there were multiple issues. And then I had done a reinspection following 2 weeks on the 27th. There were no issues, and they were reopened. On December 10th, we had received multiple complaints about a foul smell in the establishment. So I went out and I visited, and I saw two women prepping sausages in the seating dining area. The smell was quite overpowering once I entered.
Excuse me, Maria?
Yes.
You're a little hard to hear. Perhaps speak a little closer to the microphone.
Okay, hold on, let me turn it up too. Okay, so on December 10th, I had received multiple complaints about a foul smell in the establishment. So I visited the location, Hunan Kitchen at 72 East Main Street. And there were two women prepping sausages in the seating dining area. The smell was quite overpowering. There were many sausages being dried in that same seating area. And I had explained to Sheng, who is the owner on site, that a HACCP plan is probably required for this type of food preparation. At that time, I had called Jennifer Sullivan, the director, to come out and meet me on site, just to be able to verify that a HACCP plan in fact was needed for the preparation being done. I also noted that the fans being used to dry the sausages were covered in dust and all sorts of debris. There was food debris, all sorts of liquids all over the floor, pooling underneath the sausages. I asked the owner to stop doing what she was doing until Jennifer was able to meet me on site. So I also had noticed that the owner, Sheng, was not using any gloves as she was prepping the raw meat. The other employee was using gloves, but she was also touching numerous things. So there was just a lot of cross-contamination happening. There was no sanitizer being used. The three-bay sink was being used as a food prep sink, but it wasn't being cleaned in between uses. There was also food debris in the buildup, in the three-bay sinks as well. There was no thermometers, there was no temp logs. Once Jennifer arrived on scene, we made an executive decision to call Harvey's immediately because we had noted that they were going to be tossing out that food. We didn't know how long it was out. We didn't know, what the temperatures were. There was raw meat in the kitchen, in the dining room. There was just, there was going to, all the food product was definitely going to be thrown out, and we didn't want that product sitting in the dumpster for a long period of time. So that's why we wanted Harvey's to come out and empty the dumpster and also empty whatever was going to be thrown out at that time. At this time, Sheng became to be, she was getting agitated and started to become belligerent towards Jen and I. And at this time, we kind of made the executive decision to call Westborough Police just to have another person there to kind of explain to her what it is that we were asking of her. Once they arrived on scene, they helped to explain to the owner what we were requiring of them. We explained to her that, you know, we wanted her to close and that we wanted signs to be put up on the door. She threatened that she was going to leave the restaurant as is, with the food there, with the trash everywhere. And I think having the police department there was definitely beneficial. They helped to kind of ease her into saying, look, you know, that's not going to be beneficial to you in the long run. And, you know, between, I think, all three of us, you know, she did end up throwing away the food, the signs were put up. And we explained to her that, you know, we would want her at the next Board of Health meeting, which is today. I went through the report with her and she had refused to sign the inspection report at the time of inspection.
Thank you, Maria. Yeah, so I think that the action before the board, obviously, you know, besides thanking you for handling the situation that you saw presented in front of you, you know, it's what action, you know, needs to happen at this point. And I think that, I don't know, Alan, you've got quite a bit of experience on this board. I don't know if you wanted to say something or if you want me to jump in with other things I have.
I did have a question, and obviously we want to give a chance for the restaurant to give their side of things. But my question for you, Maria, you mentioned that the sausages need a HACCP plan. Is that all sausage making needs a HACCP plan, or are these being, or is it because they're being smoked that they need a HACCP plan as a means of preservation? What is it about the making of sausages that requires a HACCP plan in this instance?
So when Jen came out, we were both kind of unsure, and we actually had Ray look up the particular explanation in the food code as to what is required for prepping these types of sausages. And in fact, they did need a variance.
But I guess my question is why? In other words, does this apply to all sausage making? Maybe Ray can elaborate, but what is it about, you keep saying these sausages, what is it about these sausages that required the variance?
Ray, why don't you go ahead?
Okay, so I know Maria keeps saying these sauces. So anytime a food is made that it can be shelf stable, but it's not normally a food that is shelf stable, then they need a HACCP plan. So anytime you're changing, like we use vinegar in rice, so that way you can use it for sushi and it doesn't have to be refrigerated. Same thing with this sausage, is the sausage was being kept out. It wasn't in a smoker. It wasn't in a refrigerator. It wasn't in a temperature controlled environment. So that's whenever you have any food that isn't in a temperature controlled environment, if they want to serve that food, then it needs a HACCP plan, and they have to explain why the food can be at a temperature that is usually considered the danger zone in order to serve it safely to people. That makes sense.
And when we were there, the owner had explained that the drying was part of that process. So that meat was, you know, being hung, and these fans were being used to essentially dry out the sausage, and then they would sell that sausage to customers that way for them to prep, cook, you know, whatever it is that they were going to be doing at home.
So I think I've been to some delis where they like have salamis hanging up or things like that. Is this similar to that, or is this different from that? Do you know, as anyone knows? I don't know.
I mean, I know that in salamis and that sort of thing, I know that they do have a lot of nitrates in there, and I believe that it's those nitrates that help them stay, you know, fresh or prevent bacterial growth. I know nothing about the details of this operation, but it should be something that they're specifying in a HACCP plan, so that way we're aware of it, and so that way we can, you know, say whether that seems like a good thing to do or not.
Okay.
So one thing in the federal food code, it does talk about curing of meats and smoking of meats do not have a plan. So even though the salamis and that you're seeing in delis, they could have a HACCP plan. We don't know because it's not in our town. But if we had a deli in our town that wanted to make their smoke their own meats, then we'd have to go through the recipe and see if they need a HACCP plan. And that was
Okay.
not provided to us.
So with that, I'd like to, unless Dr. Mayer, you've got something you want to ask, I was going to let Hunan Kitchen speak for a little bit.
Hi, may I talk a little bit about this operate like a sausage, because this is a traditional Chinese food that you know, this side we taken this side since 2018, and it is a lot of limitations at this side, and we have spend a lot of time and money to get this open, but there's a lot of limitation, and we just we can only serve like a Chinese buns and some cold dishes. And for Chinese community, we cannot open full time because we have 2 kids we need to take care of, and we cannot hire people to it is hard to hire people, especially in the COVID-19 like a pandemic, you know, it's very hard to get open. So we usually open 1 or 2 times each week to get it run, get it not like lost too much, you know. We need to pay the rentals, we need to pay utilities, and then later I found a contract job. I want to quit, you know, but our customer, Chinese customer, the community, there's a lot of Chinese customers that like our food because we have a reasonable price, and they like the taste of the food, they like it, and then we actually didn't do sausage before, but this time the customer they ask us to do some, because you know it is at the end of the year, and usually in China in the winter they make sausages, so they ask us to make some.
Yeah, so it sounds like, you know, obviously limited staff, limited hours. You were asked to make sausage that you're selling, and so I think therefore you do fall under the food code here in Westborough and the state. And so we just want to make sure that when you go to make food for somebody, that you're making it in a safe way, you know, and that if you want to do things like make sausage, you know, you have to kind of make sure you're following our food code. And if you want a variance from the food code, you can apply for a variance, and we'll look at the variance, and then, you know, we can approve that variance if it makes sense. But
I actually really don't know that this should be called like this, like a sushi, because we had planned to do some sushi before, but we were told that we needed to apply the HACCP like that. So we didn't do that. We didn't continue to do that because we cannot, you know.
yeah, it's not that you can't do it. It might be that it takes a little bit of extra work, and maybe you don't have the time to do that extra work. But we've approved the HACCP plans for other places. It's not that we're against that. We actually want businesses in town that are serving the needs of customers here in town. So we actually are encouraging that, but we just want to make sure that we're doing everything correctly, though.
Yeah, I don't have experience in restaurant before, because I was a scientist before. I because you know there's a lot of corruption in the scientific, and then I lost my job because I can't get the funding. and then I have to do some business to support my family. That is, Ray. I think Ray and the other people know well about the history of our restaurant, and I really don't know that do Chinese traditional food like a sausage. We needed the HACCP because this is the way we make we make sausages in China.
Yeah, I mean, I would say that there's actually quite a few different countries where the way they make certain foods might not necessarily align themselves with the traditional way that the food code is written here in the United States. And I certainly can't speak to every method that's out there in other countries. And so, part of being a restaurant owner is trying to get familiar with these rules to make sure that you understand what you're allowed to do and what you're not allowed to do. And then if you need a variance, to apply for a variance with the explanation of why you think that the conditions you're doing it under are still safe. I don't know, Alan, it looks like you came
Yeah,
off.
I want to know who at this restaurant has gone through the Serve Safe program, who's the person in charge, those kind of questions.
I mean, who in charge of the Serve Safe?
So my understanding is that for restaurants, there's always someone who is designated as the person in charge who makes sure that everyone is complying with the food code.
We actually, this restaurant is owned by me and my wife. Is a family business, and most of the time just we two, and we all, both of us have the.
You both have gone through the Serve Safe program?
Yes.
Okay, because I mean, I think that does cover like using gloves when touching raw foods and things like that. And so I would be surprised that some of these violations that we saw occurring were happening if both of you have completed and understood the Serve Safe requirements.
Yeah, I didn't, when we take the Serve Safe courses, there's no specific requirement for sausage. He doesn't mention that, but I know that there's some kind of like a requirement for the sauce for the sushi, but like the sausage, I really don't know.
Okay, but I think there were some other things in Maria's report that were, I guess, to me as concerning. Things like thawing meat without monitoring the temperature. What's your comment regarding that?
We add this sauce, like this alcohol is a high concentration of alcohol that be used, and some other like pepper and some other sauces that can prevent the meat from you know that we need to mix the meat with the sauces and then put it in the stuff, and in this way we can prevent the meat from being bacterial growth.
Yeah, so I think that whenever you have one of these alternative methods of preventing bacterial growth besides just keeping things cold, I think those are the things that, as Ray was mentioning, and I believe is mentioned in Serve Safe, but should be if it's not, is that those are the things that require that HACCP plan. And that's, I think, where we're getting into a lot of the issues, is that when we walk in and we see, raw meat on the counter, that's really concerning to us. And if we had the HACCP plan where you describe that, oh yeah, well, this particular treatment makes it so that we can do this, that makes us a lot less worried. But without that, we don't really know what you're doing. All we can see is what's in front of us, which is concerning.
Yeah, actually, because I said that because we added a specific sources that can prevent the meat from like growing bacteria, and that is a actually I found south of China, and you know the temperature there is much higher than here, and you know people just do it like this way, and we you know we very much have a concern about the health of the people, you know, if and nothing happened before like for like food safety, nothing happened for our customers.
I
Good.
mean, yeah.
We all have the same goal there.
Yeah. And then the other part of this report that I have in front of me, or at least one of the other parts of this, is kind of relates to the cleanliness. You know, using the fans that aren't clean, and that, you know, like storing some of this thawing meat like in the sinks uncovered, you know, makes things really prone to kind of environmental contamination. And so that's also a concern. And so I'm trying to figure out how we get you to the point where you can actually, you know, serve this, you know, make food for your customers in a way that your customers like it, but still meet all of the requirements of the food code. And I don't know, maybe we can get some comments from some of our staff. Maybe they have ideas or recommendations on how we should proceed, because I mean, it sounds like we all have the same end goals, and I would love to be able to try to get there if we can.
So when they change their menu, they're supposed to submit a menu to us. So I suggest if they, before or prior to cooking, that they actually produce that menu for us so we can review and help educate them in what needs to be done and see if it's allowed.
And with that menu, some of the preparation as well, in terms of how they're planning it, because if they just say they're serving sausage, that might not indicate that they're making the sausage versus they're just, you know, cooking it.
You
Correct.
know,
With Hunan, I do suggest that just because we're not familiar with what he's currently doing.
Yeah, Frank, were you going to say something?
yeah, you know, we usually don't make sausages. Just this time is just the requirement of our customer that they have you know, they have a need. So
I will say that when we went out there in October, they were also making something we weren't familiar with.
yeah, that is Chinese 粽子 mean, you know, that time that also Chinese traditional food. That's also at the request of our customer. They want to try, you know, they like our food, and then they like Chinese culture, like that is long time, like more than like 2,000 years of this food.
So I suggest that they do get a HACCP plan to move forward if they plan on doing this traditional food.
I mean, that sounds very comforting to me as well. And I think, though, that, Frank, it might be that you have to give your customers a little bit more lead time in terms of when you can turn things around. Because if they come up to you with a new item that, you know, the Board of Health has not seen before, you might need to submit that plan to us first, make sure that we kind of approve the way that it's to be made, and then you can start actually making it. But I think if you start making it first, and then, you know, we get a complaint, or we show up, or we're doing an inspection, and we notice that you're doing something that is not consistent with the food code, then we're going to run into another big problem where we're going to have to, you know, have you throw out all your food, and it'll be a huge expense that we don't want to see anybody have to do when, you know, I mean, times are where they are right now. You know, we want to kind of make sure that everything's been signed off before you actually start one of these new items. Does that make sense?
Yeah. I you know, I really like do not know the specific food like Chinese traditional food. So, you know that has never mentioned in serve shape. You know,
So
and
there is,
Chinese people here they make at home. No, not the people make at home.
We do not regulate home kitchens for home consumption. There's a lot of things that wouldn't stack up to the food code because what we don't, honestly, if somebody doesn't cook properly at their own house, for the most part, the only persons they're endangering are their own family. But, you know, if there's a problem at your facility, it can affect, you know, 100 people, and then we have a big problem. And that's what we concern ourselves with.
Mhm.
So in terms of what you're currently doing right now, do you have a menu that you said you're open 1 to 2 days a week? Are you open right now? Are you shut down right now? What's the status of the Hunan Kitchen right now?
You know,
they're shut down till this meeting until you decided what to do.
do anything, and every time it's like when we like last time in the zongzi and this time the sausage, we spend a lot of money to prepare the raw materials and we cannot open for almost 2 months like a total.
So here's what I would suggest. I would suggest that you or your wife come in with the menu, go over each of the foods and how they're made with somebody in the office, and then you can reach a determination what needs a HACCP plan, a HACCP plan, and what does not.
Mhm.
And anything that does not, you can start, I'm okay if, you know, as long as you are doing things in a cleanly way, you know, everything is according to the food code, you can serve those foods, and for the things that need the HACCP plan, then, you know, you can develop those plans and submit them to the board. And the board, if the board approves them, then you can start serving those foods.
Okay.
Does that seem
I
fair? Oh,
have
go
a
ahead, Melissa.
question. Another concern I have is the fact that it sounds like no one has signed the report that was made by Maria, and correct? I mean, because to me, that would be really important, knowing that all of those things that had been seen and that had been done were not being done correctly. And so if we're going to say, you know, yes, you can go ahead and start serving certain things that don't need special certification. I mean, what I read in this report, there were many other things that were concerning, as we've already mentioned, and I would think that that report needs to be signed.
So I agree with you, Melissa. It needs to be signed, and obviously the deficiencies need to be corrected.
Yes.
Yeah.
Yeah,
Yes,
I think the first step in correcting them is acknowledging them. And I think that's
Yes.
what Dr. Mayer is saying, is that we
yes,
need them to sign it. So maybe when you come in, we can have a copy of that report and you can sign the report when they come in with the menu to kind of review those items.
And also Maria will have to do another reinspection to open, and she can also go over any issues that are there that day.
Okay.
I think that sounds good. Any other comments from anybody? Good, well, thank you, and I hope we,
Have
oh,
something.
wait, go ahead.
Jen, you want to go first?
Sure, I was just gonna say, there are some state resources that Frank can look into that we can provide for him. Just for him to contact to get going on this HACCP plan, or to see if it's something that he's interested in or that he can pursue on his own.
I was going to say the same thing. HACCP plans have to be reviewed every year by a professional. So most HACCP plans have to be built that way, and the food has to be sent out to a lab to get tested. The recipe gets sent out to the lab, and then the lab okays it, and that's part of the HACCP plan process.
Okay, yeah, so any details you can provide him in terms of that, just so that it's not all verbal in this meeting, if you can follow it up with an email or something like that, that would be great. Good, so I think that concludes the discussion on Hunan Kitchen. I'd like to move ahead to the 7-Eleven discussion, if we have someone from 7-Eleven on.
We don't.
Okay, I think that they were originally wanted to discuss the late fee, and I believe that if they aren't here, and I mean, my feeling is looking at the data that's presented, it was pretty clear the late fee was properly noticed in the report, and that there's no reason why it should be waived, unless there's something else that someone wants to comment on it.
You mean
No,
the late
just-
fee for my application?
No, so this is, I think that as far as Hunan Kitchen, you're all set with what we've said so far. We've now started to move on to the next restaurant on our list, which is 7-Eleven.
Frank, we'll send you an email to follow up with this meeting on what your next steps will be.
Okay, thank you. Thank you.
Thank you, Frank.
Yeah, thank you.
Dr. Ehrlich, I think you were about to say something?
Yeah, just for the sake of the minutes, I think it might be good just to have somebody briefly recount the facts, and then we can, move on. But I just,
Yep, no, I think that's
you're
good.
saying in a way that assumes we all know what's going on, which is true. But for the sake of the minutes, I think it's helpful.
Yes. Who on the staff wants to take that one?
I will. The owner of 7-Eleven reached out to us because on November 8th, a letter was sent out to all establishments, giving them a month to complete and submit all required paperwork and fees. And on December 30th, he came in to submit this paperwork. However, while explaining to him that it was late, he refused to pay the late fee. So then on January, he questioned about the highlighting in the renewal letter that was sent out, and he just didn't agree with it. So then on January 2nd, while we're reviewing all permits, it was noted that he still had not paid that fee, and I called him and told him that he needed to pay that fee, or he would not be able to remain open because he'd be working under an invalid food permit. So he did come in and pay the fee, and we did tell him that he did request to be on this meeting to have that fee returned. So this is where we are now.
So I would like to note that you provided us with a copy of the letter that went out to everyone, which does say that there will be a late fee if it's not received after 2021, of December 15th, 2021, no exceptions. So it's pretty clear, and I haven't heard a reason why there should be an exception.
Yep, so I recommend that we continue to not refund that amount that was already paid as a late fee. I don't think we need any more action on that, though, unless, no, okay.
Thank you.
Yep. So then it being about 6 o'clock, I think the next item on the agenda was a discussion about COVID-19. I think that we have a plan to kind of keep revisiting this topic, while case counts are high and while we have mandates in place. We have received, continuing to receive emails and information from people in town, and we continue to read and listen to those. And, we also independently go out and look and see what the status of the situation is in town and in the hospitals, and, try to keep our, finger on the pulse of where things are. I don't know, Dr. Ehrlich, did you want to give a little update or introduction, or?
Well, I would like to comment on some of the correspondence that people have sent in. So there were a number of people who wanted to know what was the scientific basis for why we opted to go ahead with a mask mandate. And in response to that, I know you had some correspondence with some people, as did I, and we wound up posting some scientific data on our website about the effectiveness of masks. And so that's available for people to see, I believe. Jen is on our website. Yeah. And so that's, we've done that to try and be as transparent as possible, that we believe that masks have some benefit. They're not perfect. Nothing is perfect. And that given the extent of the strain on the hospital and healthcare systems, that we thought that was appropriate. Some people want to know, well, is that data that's from Westborough, or is that just data in general? And the reality is, we can't make decisions about what to do based solely on what's happening in Westborough. The information isn't there. And when we make decisions, we obviously have to do it based on the best available evidence. And if we can look to other situations that are similar to Westborough and we see how things worked out there, we don't have to make all the mistakes ourselves. We can learn from what other people have done. And so I just want to have a realistic approach to having people understand our decision-making process. If we get it right, great. If we make mistakes, they're done in good faith, and we will change course when we need to. So that was just, I want to make those comments regarding the correspondence we received. If anyone else wants to say anything, I'd be happy to yield, and then we can talk about sort of the current state of things.
I can certainly say that when it comes to hospitals, my personal experience, not as a physician, obviously, because I'm not, but when I've talked to people in the hospitals, they sound like they are full or nearly full, that they are canceling or delaying elective surgeries, and potentially even delaying non-life or death threatening surgeries, including some cancer surgeries. And so from my point of view, I think that the hospitals still are kind of at this critical point, but I'd love to hear from the other members of the board as to whether they still have that same sense that the hospitals are, in that critical state.
Yeah, I mean, the hospitals are definitely in critical state. I'm affiliated with a hospital. I get emails every day that, code red status every day. And certainly my ER friends and colleagues, I'm hearing from them every day about what's going on in the emergency rooms and on the floors. We're at a state right now where the positivity is continues to be high. It is going down slightly, which is good, hovering around that 20% positivity range for Massachusetts, Westborough, Worcester County. Westborough is slightly lower than Massachusetts and Worcester County at 18.5% positivity. We are seeing, case counts coming down in Massachusetts, which is good. And there's even talk that Massachusetts may have peaked. However, hospitalizations are pretty much at a plateau right now. They today were slightly lower. I'm sorry, not today. The last posted date, I think, was Friday. Slightly lower, but still they're saying is at about a plateau. And 3,200 hospitalizations for COVID in Massachusetts as of January 13th. And every day that is about the same right now. And a lot of people are saying, what about Westborough? What about Westborough? And unfortunately, we don't have, as we explained at the last meeting, we don't have exact numbers for Westborough, for hospitalized people, for deaths at this time. But so we have to look a little more globally at the state and all throughout the state and what's going on. And we do know, even with Westborough, with a high vaccination rate, out of the 3,200 hospitalizations on January 13th, 1,547 of those were considered fully vaccinated. So even fully vaccinated people are getting very sick. So we really can't just assume Westborough is going to be fine anymore because we have a very high vaccination rate. We're seeing our numbers in Westborough continue to go up to 400, counting the 9 at-home rapid tests reported last week. And I'm assuming that number is actually much higher because of the extreme limitation and the ability to obtain PCR testing in the state. I personally have gone on to try to book PCR tests for my family in the past 2 weeks, and it's very difficult. The most success I've had is going through our doctor's offices, our PCPs, and I continue to recommend people to do that. That's the best way to get tested right now for people. But because people are having such trouble getting those PCR tests and buying rapid tests, you know, I would assume our number is much higher than 400. So we're still at a high crisis point in the state. In Westborough, we had 139 students in our schools test positive as of last week, 20 staff. Our case incidence rate, our percent positivity rate, both in the very high levels right now. And when we're in very high levels of virus and case counts and positivity rates, the CDC recommends indoor masking. So that is why I think we, need to continue indoor masking. That's why we discussed the mask mandate last time. Hopefully if we're at a peak soon, we'll start seeing numbers going down, which would be wonderful. However, as I heard someone say on the radio driving home today, just because you're at the peak, that doesn't mean things are going to plummet right away. They're still going to be high for some time as they go down the other side of that curve. So I don't think we're certainly not in the clear. But
Thank you, Dr. Mary. Dr. Ehrlich, do you have some comments?
Yeah, just yes, I would agree that we certainly still have a lot of COVID activity. Where I work, I see a lot of it. And I do think the data shows that the numbers have the case rate, the documented case rate appears to have peaked and is coming down. But just as on the way up, there's a delay between cases and hospitalization. That's also true on the way down. So I would expect the hospital burden of COVID to remain for at least another probably 1 to 2 weeks. And then hopefully at that point, it will see the beneficial effects of fewer new cases and people getting better.
And when you say that our case counts are going down, are you talking about the Westborough case counts that we're doing?
Not Westborough.
Those are still going up, right?
Yeah, though, it's higher. The rate of going up slowed immensely. We were doubling every week for several weeks in a row. And now there was just a relatively mild increase week to week. We'll see how this week goes. But, in this across the state, it does appear that case counts have peaked.
And on the fact that we have, more cases this week than last week, even if it's a smaller increase, I do want to point out and maybe get some comments from our staff that the Board of Health really is kind of overwhelmed when it comes to contact tracing, and even in terms of just notifying everybody that had a positive test, to give them the details on how to isolate and that sort of thing. And I believe that we're now no longer able to contact all of the people and all of their contacts. Is that correct?
Correct. So we've been doing elderly as of right now, and the schools have still been doing children, and we've been trying to reach out to under 5 as well.
So it's important for anybody listening that if you do get a positive test and the Board of Health does not specifically reach out to you, you should still be following the guidelines for isolation and, not going back to work or back to, your normal activities until after 5 days. And even then, it's probably at least 5 days. And then to wear a mask until at least day 10. Is that correct?
Yes, and also just remember to count day 0. That's important. A lot of people don't remember that.
Yeah.
And if you have any questions at all, please reach out to us. We're here to help. And we also have everything on our website. So we have all the isolation guidance, and if you're a close contact, we have all the quarantine guidance on there. So again, feel free to reach out.
Even if we don't reach out to you, feel free to reach out to the Board of Health.
Yep.
Okay. Good. And then, go ahead.
One thing I also did want to mention is back the counting the day 0. So you're counting day 0 and you're supposed to stay home through day 5, then you officially aren't going back to work until day 6, which is almost day 7, correct, Jen?
Right. And so
because people tend to count wrong.
They do, and also just it's really important to make sure you don't have a fever for at least 24 hours prior to your release of isolation without any fever reducing medication, and obviously your symptoms have had to greatly improve, and that mask wearing later is very important as well.
Yeah, and even though I think the CDC advice they kind of they gave out was to balance the risk to the greater population with the economic risk of not having people go back to work. And so it is important that even if we are going back to work after that day 5 and you're wearing the mask, it really is important to wear the mask because people are still spreading the disease after day 5. So, if you can extend it longer, I think staying in isolation longer is still better, but obviously, we all have to do our own independent math as to, what those economic risks are for, going back on day 6.
Can I also add something?
Yes, please.
So if you do test positive for COVID, technically you don't have to isolate for 90 days. We're seeing a lot of cases that pop up within that 90 days. So if you believe you are symptomatic, you fall within the realm of those symptoms, consider yourself positive because you could test positive for up to 90 days after you originally test for COVID. So just if you could possibly still test positive or have COVID, and we ask that you just follow those isolation guidelines. Again, it's not written by DPH as of yet, but we've been told that it's going to come out.
So if
I'm sorry,
understand
Jen, I think
correctly,
I
you're
think
saying that if you had COVID and you recover from COVID, that you still could get COVID again, even if it's within 90 days. Is that what you're saying?
Yeah, that's what we've been finding with this
Okay.
Omicron
Is that
variant.
what your question was, Dr. Mayer, as well?
yeah, I just wanted to clarify what she had said.
Thank you.
And then the other thing that I wanted to bring up was that I think DESE was releasing some new guidelines today, and that they've revised some of their programs and that they're now encouraging districts to stop the test and stay, and that they were also in contact tracing in favor of at-home testing and pooled testing. And I just kind of wanted to get your comment on that. It seemed to me that this was kind of in recognition of how to best use both nurse and school time, was to kind of get away from the test and stay and to kind of provide kits for at-home use for students so that they could kind of test weekly. But Jen, I'd love to have you comment a little bit more. I think you've read a little bit more about this program than I have.
Sure. So the schools in Massachusetts have the opportunity of signing up this week for the the at-home testing option, and to remove themselves from the test and stay. However, if they do choose to do that, they will have to either test for symptomatically or create a pool testing. And then on the 23rd of this month, the test kits will be delivered to staff. And then the 31st of this month, this test kits will be delivered to families. However, you have to sign up with your schools in order to receive those test kits for the families.
Can I ask you something, Jen? So are you saying that in order to continue test and stay for unvaccinated, like you can't opt for this program if you're going to keep test and stay for the unvaccinated, or can you?
So you can continue a test and stay and follow the same procedures you've had, or you have to adopt this at-home testing program.
So it's one or the other?
Correct.
Yeah, and I believe that the test and stay is eating up a lot of nurse and school time during the day. And I believe that that's why DESE is recommending that we switch to the staff and the students testing once a week at home with an at-home test provided by the schools through DESE. And then also followed up with some other type of surveillance mechanism, whether that be symptomatic testing or pooled testing. And it sounded like they were preferring pooled testing, but it wasn't really a hard and fast decision. It seemed like from DESE, they kind of were leaving that open, but their examples all referred to pooled testing.
DESE actually invited local boards of health on their call for tomorrow, so I'll be on that and I can update you when I know more.
Okay. I don't know if Dr. Mayer or Dr. Ehrlich have actually seen these guidelines or read them too much, but I would be in favor at this point with what I've seen so far to recommend that the school pursue the at-home testing and the pooled testing.
So I do have another question. I have read through it, not since it just came out today. Maybe I missed something. So if tests go home to families, this isn't something that's mandatory for families, I'm assuming.
You're right.
So it's families are given these tests to do weekly, but it's not anything they're going to be reporting in.
Right. So they are required to report the test results to the school.
Positive.
Yep. And then they'll report it to the state or DESE. And then that's why they also put in place this symptomatic testing or continuing that, because it's not a mandatory. So if a child goes to school symptomatic, they can catch it there.
And I believe it is an opt-in program rather than an opt-out, meaning that the parents or the students have to take some step to actually say they want to be part of it, rather than the assumption being that everyone's part of it unless you say you don't want to be. So I think it's an an opt-in program. But it's one that I would recommend that people do.
Right. I think as the Board of Health, we should make a statement recommending we enroll in this program. I don't know what our school committee or what Amber, I don't know if they're planning on enrolling in it, but I certainly think it's a good idea.
Because this just came out today. I have not talked to anyone in the
right.
schools yet. And so this is probably new to them as it is to us.
Yeah.
Dr. Ehrlich, did you have some comments?
Yeah, I mean, the way I've only had a chance to look over it briefly, but the way you introduced it sounded like, well, this is being done to make the lives of the school nurse easier, to ease logistical burdens and things like that. And if that's the case, it would seem to me that the school board is the one who is in the best position. They're in more direct contact with the school nurses and Amber. And so I'm not sure I have an opinion one way or the other as to whether this is a good idea. It's not I'm not viewing it as being proposed to increase the safety and well-being of the children, which might be in our purview, but if it's something to improve the functioning of the schools, then that's a school board decision. And I'm not sure. I mean, if we want to say we think this is a reasonable thing to do, okay. But
so one benefit that this would have was that if students are being tested once a week, then in some ways we're sampling a lot of the families in town that might not otherwise be tested. Because COVID does tend to spread within households much more so than between households, that people that might not otherwise have had a COVID test might be tested by this when you look at it in terms of households. So I think it does actually help in terms of identifying, maybe whole households that might be asymptomatic, but spreading the disease. It might be helpful in that sense. And so from a community point of view, I do think that it might have some benefits.
Yeah, I agree. The CDC just came out too with new guidelines for schools, which I'm sure is what somewhat prompted this, and saying that schools should focus more on screening testing. Probably society, which a lot of companies are doing and all that too, screening, weekly screening testing, which this is. I do think the symptomatic testing is super important too. I can't imagine that anybody would want that to go away. Right, Jen, that they're not talking about getting
Not
rid
at
of
all.
it. So, one thing that I have read in the new CDC guidelines, and I'm not sure if DESE has touched on it, which I thought was interesting, was recommending screening kids in high-risk extracurricular activities too. So I don't know if, Jen, this could come up in any discussion. And just CDC mentioned things like band, singing, and wrestling. And it was interesting and talking about screening, especially screening those kids who are in those activities. Jen, do you know what our vaccination rate is of age 5 to 12? Do we have that number?
Not readily available, I do not.
Okay.
I can try to find it before the end of this meeting.
And so, Alan, as far as a recommendation, you kind of preferred not to make a recommendation, but to kind of leave it in the school hands. And Dr. Mary, I think you're favoring a recommendation. Is that, am I understanding the read of the room?
I mean, I think any testing is good. I think if they're definitely going to stop contact tracing, which I know that there's been a lot of that in the schools, and they're going to focus more on testing symptomatically and doing this at home testing. I mean, I think more is better, but I do think if it's a question of enrolling in this program and not enrolling in this program, then I would recommend enrolling in this program, because it certainly is not a mandate for Massachusetts towns to enroll in this program. And certainly if they are going to stop with the amount of contact tracing that they are doing, which DESE is telling them that they can do, I think we need to be where they need to be doing something, and recommending to enroll in the program is a good idea. Certainly.
I believe one of the limits of the current test and stay program is that they're only allowed to use those DESE supplies for unvaccinated children, which I think rules out potential tests for a lot of people. There was some discretion that the nurses had, but my impression was that, unless they met a bunch of symptoms, they couldn't use those supplies to test vaccinated students. So I think this new program doesn't distinguish between vaccinated and unvaccinated,
right,
and encourages everyone to be tested. Dr. Ehrlich, I think I might have cut you off. So
Yeah, no, that's okay. I was just starting. I just want to react to something Dr. Mayer said about, testing being basically good. And I'm not 100% on board with that. The more testing is better. We do know that there are people who are completely asymptomatic, get identified, and obviously there's disruption. And, if that were in effect, if that were an effective way of limiting the spread, great. But at this point, I mean, the Omicron variant seems to be endemic, and it's not clear that identifying asymptomatic people, it really is feasible. You're going to focus on students, okay, but there's a large swath of the population besides them, and we're not recommending everybody get tested weekly. I don't think anyone, even a public health message, if it were possible, is recommending that.
Actually,
I disagree. Some countries are doing that, Alan, and some companies are doing that. So
I know companies are doing it, but
yeah, I mean, so and countries are doing that. Britain is doing that. I mean, I think that is what the CDC is currently recommending, is focusing on more testing.
Okay, so if Britain's testing people weekly, what good is it doing?
1544. I mean,
the other item is that the federal government, it now has a new program through their website. I think it's covidtest.gov, where you can sign up as a household and get a certain number of tests for your household every month. And so even the US government is encouraging people to get testing if they want it, and sign up for it and have them delivered through the UPS right to your own home. And that way you can test yourself. And I believe that is also set up as, now I'm going to get the details wrong, but I thought it was, 4 tests.
It's eight a month, 8 a month per person.
Okay. And so I want to take issue a little bit, Dr. Ehrlich, with you to say that, what good does it do? I think that all of these things are layered approaches. And I think that if we can help a few people that might have otherwise gone about their day and that really are COVID positive and potentially spreading the disease, and have them second, think about it a little bit more and decide to not go about their day the way they were and to isolate. I think that is a really positive step, and I think it does help. It's not going to reduce our case counts to zero overnight. I'm not saying that it will, but I do think that having people know whether they're infected is important and will change behavior, or at least it should. Obviously, anybody who's not going to change their behavior either way, it doesn't make sense for them to be tested. But for those people that would change their behavior, I think that it is a positive thing to get tested. My worry, though, with lots of testing is that false positives become a large problem. In that,
The false positives are not considered to be a major problem right now. And if you talk to most experts with the high degree of positivity in people and in this country, false positives on rapids are not considered to be a big problem right now at all. And one of the biggest problems with COVID, Alan, is the asymptomatic spread. So I do disagree with what you're saying. And I think, screening so that we can catch those people who are, positive and without symptoms, so that they are not going to be infectious among other people.
Yeah, a year ago, I would agree. With the current state of things, I'm not sure that it makes a difference. That's all I'm saying.
I have that number for you if you're interested.
Oh, that would be great. Thank you.
So 5 to 11 vaccinated is 73.6% of our kids.
That's great. Getting there. Thank you.
Yeah.
And I did want to add earlier that, oh, I'm sorry. Never mind. Correction.
Okay. So I think we've actually covered quite a bit of background and a little bit of status as to where we are now. Where I'd like to move to is, our current recommendations, and also to relook at our current mandate to see whether, we need to do anything about it, change the date when it expires, either extending it or shortening it, or just, keep it for the next meeting. And, again, reviewing kind of our overall recommendations, which I think we're all on board with, would be a good thing to just review as well. But let's maybe first tackle the mandate, if everyone's on board with taking that up as the next issue. We basically had it expire, I believe, at the end of the month. And we wanted to revisit it today to see whether that still seemed like a reasonable goal, or now that we're a couple weeks later, whether, we think that cases are, based on the data that we've seen, whether we need to kind of keep it in place into February as well. I don't know what other people's thoughts are. Otherwise, I can go into my thoughts.
Can I make a suggestion?
Please.
I would like to see it last until the end of the month, but yet meet again January 31st to review, to see if we need to extend it further.
I have a different suggestion.
Okay.
My suggestion is we extend it to February 1st and meet on February 1st, which is a Tuesday that the staff meets anyhow, or is
Okay.
late, works late anyhow.
Thank you.
Thank you, Ray.
Yeah, I mean, I think though that only giving people a day to adjust is not necessarily how I like to do things either. If we think that it might be that we're going to be keeping it in place, it might make sense to, have it go until, a week or two after that meeting. And then maybe at that meeting, we could, if we decided that it didn't need to be in place, we could, let it kind of run its course, but it wouldn't be overnight. It would kind of give people a few days to know whether it is ending or not. I think our current mandate requires like a whole bunch of signs to be up. And if all of a sudden, everything changes overnight, it's just a little disruptive to people to kind of figure out, whether they need to pull down signs or change the billboards, all of that sort of logistical stuff. If we were going to make a decision today to kind of end it, then, having it end at the end of the month, I think would be reasonable. It gives people plenty of notice. if we were going to have our meeting on, February 1st, I might prefer to extend it until like, February, 7th or 14th or something like that, so that we kind of can have that wind down period, of a week or 2 weeks.
Nathan, I think taking things away, if you extend the mandate, the signs just stay up. I don't think
Yep.
that's that hard. I think, from my perspective, even if the mandate ends February 1st, if that's how we do that, I think it unlikely we would not continue to have an advisory in place. If we see the hospitalization rates are down and whatnot, COVID's not going to be over. And I don't think the CDC is going to have revised their recommendations. So at the very least, we'll probably still have an advisory in place on the masking. So, if you want to say, okay, fine, we meet on February 1st and whatever we do, goes into effect on Friday or something like that. So there's a couple of days, but I don't think you need a week or two as you're proposing.
Yeah, I agree.
Okay, well, then I'll leave it up to you two if we want to pick a date that we wanted to extend to. I think you, Alan, had proposed the 1st.
I think we should meet on the 1st is what I guess. And so realistically, we should take an affirmative decision one way or the other as a group. So, if you want to extend it to the 2nd or the 3rd, I'm okay with that. I mean, it's really just a practical matter.
Okay, so why don't we have it
Yeah.
extend? I'm going to
Jen?
propose that we, sorry.
It looks like Jen wants to say something.
I do. I just think that if we extend it now, currently, I think it's going to confuse others. So I think if you could have a decision by the 31st would probably be more helpful.
Okay, all right, so you really want to meet on the 31st?
Unfortunately, I don't think we really have a choice.
Okay, I will meet on the 31st.
Yeah, that would be, I mean, unless we wanted to meet a week before that on the Tuesday, but yeah, otherwise we'll meet the 31st then.
Okay.
Let's keep it to a single agenda item so that the meeting is just talking about that. We'll try to keep the background and everything fairly short on that. Okay, so we'll keep that expiration date then of the 31st. We won't extend it today, but we'll meet, and the likelihood could be that it is either extended or not. I think each of us already have our own feelings there, but we'll see how the data drives us and we'll follow the data.
I just think you should also discuss how you currently feel.
Yeah, so currently, my
About the
thoughts, I'll jump in first, but my thoughts are that, when we're having more than, 10 cases a day, that seems like a lot. And so doing things to help us reduce our cases makes sense. We had tried advisories and that still wasn't enough to reduce our cases. While hospitalizations are high, I also feel the need to do stuff to help relieve the burden of hospitalizations, but I don't want to be too far out of line of the towns around us, because I do think that it does hurt us economically when we start doing things that other towns around us aren't, with very little benefit to the overall hospitalization rates. I think that Westborough's contribution to the hospitalization rates are just one town out of many that feed into the hospitals. And if most of the towns are jamming up the hospitals, it doesn't really matter what we do if the hospitals are jammed with everyone else's patients. So I do want to be on the edge of where the towns near us are doing, but I don't want to be so far out ahead of them that, we're compromising our own economic benefits as well. So that's kind of where I am. I'd love to hear what Dr. Mayer and Dr. Ehrlich are as well.
I think with the numbers as high as they are, I would keep the mandate as is. I think a lot of surrounding towns have done the same. Northborough, Southborough, Marlborough, Shrewsbury had it before us. Certainly we're not alone with this. I definitely read some of the emails of concerns from some people. I think in general, we did not get a lot, just so people know. I mean, I think in general, people are not, a lot of people are not unhappy with masking indoors. You know, some of the questions were, you know, why some establishments have different rules than others, you know, gyms or restaurants or that kind of thing, since we really didn't get into details with the mandate that we had, you know, a year ago about, you know, very specific rules in restaurants and capacities and all that. And but in general, I think I would leave it as is. The only thing I would consider changing is that 6-foot comment that I mentioned last time, but I don't know if it absolutely needs to change, but there was the comment in the mandate of if you can space 6, I don't know if it was actually 6 feet, that you could remain, you know, unmasked. And I think that has caused a little bit of confusion.
You know, I don't have an opinion today because my opinion is going to be fundamentally based on what the numbers look like and what's happening with the hospitalizations and things like that. I do think that things like the mandates are a tool we should utilize very judiciously, that anything that creates friction between public health people, such as the people on this call and the public, is something to be very careful about. You know, doing it when it really is going to make a difference, makes sense. At other times, the benefit from it may, you know, needs to be weighed against problems that are created when there is an adversarial relationship between health authorities and the public. And so that's what my, you know, those are factors I try and balance.
Well said. Okay, and so I think now we just come to kind of reiterating some of the recommendations that the Board of Health has had in the past, and interrupt me if I say something that you guys don't agree with, but I think getting vaccinated and boosted is, you know, something that we've been saying all along and continue to say. Getting tested if you have symptoms is important. You know, wearing masks is one way to help reduce the infections and spread of infections. And that I think we've said in the past that the N95s, when used correctly, outperform the surgical masks, and that, you know, surgical masks, when they, you know, don't have big gaps on the sides, outperforms kind of the single layer cloth masks. But ideally, it's better to have a mask that you use than a mask that you won't use. And I think some of the things that maybe we haven't said, but when it comes to gathering with others, I don't know if the Board of Health would recommend that people test before gathering in large groups. It's certainly my feeling, but you know, I think those are kind of the recommendations that the Board of Health has had in the past. I don't know if the other two members kind of agree with those or would like to alter them or add to those.
I think that's you know, what you said has been consistent with what our policies have been.
Good. I think that's a nice way to end, but if there's something else that people want to say, I think we do have maybe approval of minutes that we wanted to do, although I'm not sure I have those minutes. And so
They weren't in the packet.
Okay.
Can I just, I'm sorry, add just a few more things about COVID.
Please.
You know, one thing that we didn't mention, when if somebody tests positive, the current CDC guidelines are to, if you are able to, you know, do a rapid test on yourself before going back out to work or into the community, that is something that is not a bad idea. The CDC didn't come out and say you must do this, as did, you know, the state of Massachusetts, but it is a good idea to do a rapid test if you have them at home on yourself. In the medical community, we are seeing many people rapid test beyond 5, 6, 7 days, even beyond 10 sometimes. So, you know, you can be contagious more than 5-6 days. So I do want people to be aware of that, and that's important. And that's why there's the masking recommendation, certainly the full 10 days. The other comment I had was back to the schools, Jen, if there's communication with Amber, and I'm not sure if they're asking for our guidance, with all these changes. Certainly, I think we should be available if they have questions and they do want our guidance on things. Other towns are, certainly boards of health are giving guidance to the schools. I know there's been question, who has the say and what goes on with the schools, but we certainly have been giving guidance all along, and we're available if they want more guidance with all these changes upcoming. I know that there's some concern in the community of getting rid of all the contact tracing, which is a lot of what they've been doing. And so, I just wanted to know if we could get information of what changes they're going to be doing. Are they going to try to do any more spacing if they're not going to be doing so much contact tracing? Are they doing as much spacing as they can, in classrooms and in lunch and that kind of thing? It would be helpful to be available to them if they want our guidance, and to, give recommendations. I certainly always recommend as much spacing that can happen in the schools. And I'm assuming, that they're trying to do that.
I do want to add that I appreciate that spacing is important, but I do want to add that there has not been, has been found that this in-school transmission does not happen often. So I just want to make sure that the public is aware of that, and schools are found to be relatively safer than not. So I just wanted to add that.
Yeah, I think that was one of Desi's important points that they wanted to make clear, was that schools still remain very safe places to have the kids, and that kids should still feel safe going to school. I think that I would prefer at this time that the schools not use their waiver to remove masking, even if we were to, stop the public inside space mandate. I would certainly feel more comfortable with the schools continuing to mask indoors as well. And I think that's part of what we typically advise, is that all indoor spaces continue to wear masking. So maybe we'll have the minutes for the January 31st meeting, which I guess sounds like will be our next short meeting, and then maybe we'll have a follow-up regular meeting. Unless there are other directors' issues, Jen, that you want to bring up.
No, thank you. You allowed me to address them all during our meeting.
Okay,
I will have the minutes done.
excellent.
It's been a rough couple of months.
Been a little busy answering that phone.
Yeah.
Thank you very much for all those phone calls.
So the next two meetings, if we were to put one on the 31st and then put one on February 15th, does that work with everybody's schedule?
Mhm.
Yep.
I don't know, on the 31st meeting, would moving it a little bit earlier in the day be helpful for our staff or for our other members of the board?
We're always open to that.
I mean, we
I
could
can be
try to-
available whenever. I don't know what,
I mean,
whatever schedule works.
If we did it at 3 and we tried to keep the meeting fairly short, do you think that would work? Or we could do 4?
That would be hard for me.
What time would work for you
I
then?
think
Dr.
the earliest I could probably do on a Monday is 4:30.
Okay. Why don't we then go ahead and try to set it up for 4:30 then?
Okay,
Thank you.
4:30 works.
Okay, do we have a motion to adjourn?
Motion to adjourn.
We have
I
a second.
A second.
Dr. Ehrlich,
Ehrlich, yes?
Dr. Mayer,
Mayor, yes.
Dr. Walsh, yes. Thank you, everybody. Appreciate it.
Thank you,
Bye-bye.
Thank
everyone.
you.
Bye-bye.
Thanks very much.